A D-Xylose test can be helpful in diagnosing malabsorption-related diseases. D-Xylose is a sugar that does not need any enzymes for it to be absorbed in the intestine. The only thing that we need in order to absorb D-Xylose is a healthy, intact intestinal mucosa. So if we administer D-Xylose to a normal, healthy patient, then we would expect elevated urinary D-Xylose. The reason for this is because the only thing that we need in order to absorb D-Xylose is a intact intestinal mucosa. Now, if we give someone a D-Xylose and they have a damaged intestinal mucosa, then we would see a decrease in urinary D-Xylose. And the reason for this is because the intestine would not have been able to absorb the D-Xylose that was given, and as a result, the D-Xylose would not be going into the blood after the intestine, and so we would ultimately not be able to excrete it out in the urine. Now, malabsorption can be due to intestinal diseases or pancreatic diseases, and a D-Xylose test can be helpful in determining the cause of the malabsorption, whether it is due to a intestinal disease or a pancreatic disease. So as we talked about, we would expect a abnormal D-Xylose test if someone has a intestinal disease, and the reason for this is because they would have a damaged intestinal mucosa. A D-Xylose test will be normal in someone presenting with a pancreatic disease, and the reason for this is because D-Xylose does not need any enzymes for it to be absorbed in the intestine. And remember that pancreas is going to be responsible for producing enzymes that are going to be helpful in breaking down fats, carbohydrates, and proteins. But because D-Xylose does not need any of these enzymes in order for it to be absorbed, if someone has a pancreatic disease, we would not be able to pick it up in a D-Xylose test. And the reason again for this is because D-Xylose does not need any of these enzymes produced by the pancreas in order for it to be absorbed in the intestine. The only thing that we need is a functional mucosa for D-Xylose to be absorbed.